Kadasia from the Alliance for Health Promotion. This session will be to talk about the development of a consensus statement, a call to action that will sum up the messages from the 4 days of the combined Canadian Society for International Health Conference and the 10th Forum on Health Promotion, produced by the Alliance for Health Promotion. Over to you, Bernard.
Thank you. Thank you, Wendy. So just to say who I am again, my name is Bernard Kadasia, and I am the president of the Alliance for Health Promotion. This is an alliance that was formed way back in 1997 and has a long history of working with the WHO and other key players in health and development. I should say we are now working from very different time zones, so I don't know what you see. It's quite dark back here in East Africa. The Alliance has a long history, as I just mentioned, of working with WHO, working with other organizations in health and general development. And now we have the status of an organization in official relations with WHO, which allows us to be able to attend WHO sessions, interact with the member states, both at the executive board level and in the World Health Assembly, which occurs every year, of course, except this year, where it's been done rather differently. So we also have recognition as an ECOSOC member that is within the UN Economic and Social Council. So this then allows us as a membership organization that draws members from all over the world, organizations that are working in health promotion, to be, if you want, to be one of the major touch points whenever in international relations, wherever WHO is looking at whom they can engage, whom they can consult, and whom they can work with in terms of health promotion. I should say that this forum, this 10th forum, is one of those opportunities where we bring together professionals from different disciplines, but mainly from health and from governments and from civil society, to look at what is the important issue at a given time and what can we pick out of that as agenda and action going forward. So it is in this, with this backdrop that we should consider the forum this year. As far as Canada goes, you all know about the very famous Ottawa Charter in 1986, but also we had the Prince Edward Island meeting in 2016. And after that, we went into Shanghai, taking the action, the call for action from that PEI declaration to the Shanghai Global Conference on Health Promotion. And we had even a poster. So we do have this possibility, and it is what we want as we come to the end of the forum now. We want to go that direction and to see what are some of the key messages that come from this forum that can then go forward to inform health promotion and health and well-being and the development in general at different points. Thank you, Wendy. Do we want to go to the key messages now, or should we, first of all, get some of the pictures around what were the main points or topics that people talked about or presented about?
Yes, I'm going to hand over to Janet Hatcher-Roberts next, who will talk a little bit about the process and what we've done so far. And then I will talk a little bit about the legacy during the conference of the messages that we've already received. So over to you, Janet, for a couple of minutes, and then I will share with the audience what we've prepared so far.
Thank you, Wendy. I'm just going to try to get the screen, a full screen here. There. There we go. So we really appreciate everybody's participation in this effort, and certainly the Canadian Conference on Global Health offered a tremendous opportunity to hear from well over 1,000 participants in terms of what they're thinking and learning and listening to, which can allow us to distill some of these droplets into some priority areas for the Alliance in the future. Now, so one thing that we've heard is that we don't need to produce or market any more technologies. We need to better understand what works and what doesn't work for the most vulnerable by integrating an equity lens. And if they do work, can they be sustained for the most vulnerable populations? And then what are the next steps? We need to understand that we need to address equity effectiveness for digital technology. And what we were discussing earlier this morning was creating a platform for easy access for engagement of community leaders, planners, decision makers, and clinicians to understand what could work in their settings with their needs. And clearly, as we've talked throughout the conference, whatever we're doing requires collaboration and coordination, common methods and approaches, which exist, for example, with Cochrane and Campbell collaborations, but we have to build on the foundations of rights-based approaches and health promotion approaches. And so this obviously necessitates public, private, government sectors and civil society to work together to enhance our ability for global governance and global leadership. And it integrates promotion of well-being, human rights, health literacy, science literacy, civic literacy, and digital literacy, as Alona talked about this morning. And if we support those with approaches which embrace One Health, decolonization, and human rights, then we feel that we're moving toward a new way of understanding and moving forward. We also have to think about promoting privacy, maintaining bonds of solidarity, intelligibility, democracy in a way that contributes to a just and equitable society. So we asked the participants to give us feedback on what they are hearing and learning, and we wanted to see what areas and thematic areas were evolving. And from that, we created some word clouds from day one, and then to show the evolution from the final day to day. So day one work cloud, you can see that health, innovation, global health, and the 10th Global Forum on Health Promotion, advocacy, evidence, mental health. These are some of the themes that were showing up in larger print, meaning that they were the ones that were more emphasized than others, say, for example, like burden, equality, population, etc. Now, by day 4, we're starting to see health promotion, civil society, health equity, community, consensus, equality, and digital innovation rising up a bit more in terms of prominence. And we're able to take a look at this to see how the participants have evolved and how the conference has evolved in terms of some of that thinking. So we feel we need to ground this consensus statement on previous foundational work. And as Bernard mentioned, some of that work and the principles which have global reach and acceptance. We don't want to look at something that's very narrow, and principles which allow for intersection around health, literacy, et cetera, as we said, and principles which promote health and equity. So we have, our legacy is profound. We have the Ottawa Charter. We have, as you said, the PEI, Prince Edward Island Charter. The Montreal Declaration looks at digital technology and AI. And then we have the Shanghai Declaration, as well as many declarations on human rights that we need to consider as we move forward. So to remind all of us about the Ottawa Charter, some of us were there, some of us worked on it, and some of us continue to work on it. For me, it was with the federal government for a while, and that was a wonderful time to be involved. And Irv Rootman really took us through this in terms of its application for elderly people, but it's still extremely relevant. And then we have the Montreal Charter, which it had as its objective to develop an ethical framework for the development and deployment of AI, guide the digital transition so everyone benefits from the technology revolution, and open a national and international forum for discussion to collectively achieve equitable, inclusive, and ecologically sustainable development. And there were 10 principles with the Montreal Declaration, which moved from respect for autonomy to democracy, contribute to just and equitable society, prudence and protection, and a strong environmental sustainability. And the Shanghai Sustainable Development Statement emphasized health and well-being for sustainable development, bold political choices for health, good governance, cities and communities as critical settings, and health literacy as a way of empowering and driving equity. So when we look at the opportunities afforded by at least these three documents, and of course that foundation of human rights application, we have a tremendous legacy now to move forward. Thank you.
Thank you very much, Janet and Bernard. To increase the circle of this discussion, we're very much hoping that our audience today and the audience of the CSIH conference and the Global Forum for the Alliance for Health Promotion would be able to add feedback so that we can consider that as part of the development of the consensus statement after this conference. For those of you that have now heard, the legacy of this health promotion conference is rich from the standpoint of previous declarations. And the process for that in the past has been quite dynamic, in which consultation has taken place around the world, drafts have been prepared. However, going forward, this will be a new process. So the Alliance will be enacting a group that will be drafting the next round of declaration. And we would like to hear from all of you. If you're interested in participating, please remember that as part of your enrollment for the conference, you have been granted a complimentary offer of membership in both the Canadian Society of International Health as well as the Alliance for Health Promotion. And as a member, we would be thrilled for you to demonstrate your interest in participating with us on the key messages and going forward, so that the Alliance will be developing a small working group, and in the coming weeks and months, refining the statement so that it can be brought forward in dialogue with World Health. With that, we have a number of the participants, including Bernard, also Veronica Shiroya, and Janet, who's been here as part of past statements, and we would be thrilled to take questions that you may have around future statements or around any of the key messages that you've heard so far that you'd like to both register in the app or to share with us today. So while you're going to the chat room to register any questions, we do have a few moments. I will turn it to Bernard if there's any comment further before we open up to the floor for questions. Bernard, would you like to comment on the invitation to members to participate with us in developing the draft going forward?
Thank you. Thank you, Wendy. So again, this is a good opportunity for me just to point out a few of the initiatives that are down the road coming very soon, and we should consider as opportunities. I think that participants and also panelists and all of us here need to know that for the first time in its history, the WHO is working on developing a global strategy on health promotion. So this is going to be one very tangible opportunity for the outcome of this forum to find space and to influence and to actually be part of the development of that strategy. And that is as an outcome document, but as well as civil society and organizations, private sector, academic institutions, research organizations, all of us who have interest and are able to take part in this process, even outside the outcome document, you can get in touch with the Alliance, and as we negotiate or work with WHO to see exactly how that process will develop. But we shall have the opportunity to channel some of the output from this forum into that process. Another process that is going on now, as you may have heard several times from Ilona's comments, from Director General Dr. Tedros, from Dr. Kresh, and our consultant Mihail, and even interviewers Veronica and Wendy in the team, and even Villa in the team in equity and social determinants. Well-being is really the direction that the level that health promotion is moving, and that is where the thinking is. So again, there's going to be a process to discuss around that well-being, the creation of health, the state of mind of health, of security. So that's another opportunity. The WHO is initiating that process. Thirdly, I should say that I mentioned that the Alliance has been very active in the global conferences on health promotion. These are organized by WHO and member states. And the next such conference, if something doesn't go wrong, should be in the first quarter of next year. So again, here is a channel to which the Alliance is connected, and all of you, and also this conference and the outcome from this conference can be connected. I mentioned earlier the World Health Assembly. There'll be a mini WHA or World Health Assembly sometime before the end of this year. And also, let me say that we always have the opportunity at the UN General Assembly as an alliance through ECOSOC to also channel the outcome from here. But I also want to say that it's not all about taking the outcome from this forum to someone else. It is also to us. What are the messages? And I think that we just heard from the cloud. Some of the things are very clear. And we should take this as a source, a springboard, or a source of ideas and agenda and new ways of thinking that we as civil society can incorporate into our policies and into our programs. And lastly, I should just say in a general sense that it is really a good time for health promotion. We mentioned earlier the tragic pandemic has also accentuated an understanding or put a spotlight on what are the alternative ways to work around health, and not just curative or rehabilitative or palliative, but also not even prevention, but much before that, the conditions among people and the determinants of health. And I really also want us to remember that the conference, the global conference this year, and the forum was about climate change or changing climate. And as I mentioned, we go beyond the physical and chemical climate, but it is important to remember planetary health in all our health promotion work, and to thank the group that is working on this in WHO, led by Jenny Miller. Lastly, I want to thank the WHO, which has said that we are going to have an opportunity to form a working group on health promotion and well-being. So this is another opportunity for all of you who are passionate, are active, or want to join this movement. Ilona said it's a social movement. This is another opportunity. When we set up this working group, let us know who is interested, and we'll also share with you what exactly is that working group and how we can go around it. So I think this just some of the opportunities that I want to share with you that are available through the Alliance, are available to civil society, are available through our partnerships with the WHO and the UN system. I think this should be, and I've done many other points, many other opportunities, but when we begin to really finalize this document, we will put out a draft with these key messages and also some asks and some agenda, ideas on agenda and where we want to go forward. And we'll have this open through our website and through even direct contact so that the participants can also input so that we have a document that reflects a broader and richer outcome that indeed this conference and forum has been. Thank you, Wendy.
Thank you very, very much, Bernard. And that was a fantastic summary of some of the high points and the key messages that we've heard over the past number of days. As a reminder to the audience, you can access taped video archive of each session. And if you've missed it, some of the sessions that Bernard was recapping were incredibly moving and motivational from the standpoint of linkages between health promotion and other aspects of the sector and of population health and world health influence, and also some very cross-cutting and interesting and important issues around equity, digital innovation, civic, digital, and other kinds of literacy, and the very important role of co-design and collaboration, as well as North-South dialogue. I'm wondering if we have any questions from the audience. We have a few minutes, and with us able to respond are Bernard and Janet, and we also have Veronica Sharoya, who's participated in the Alliance before. So please feel free to direct your questions through the chat if you have any for a few minutes. There's also been an interesting question to engage the group. If you have any recommendations for us on a word that would sum up the 10th annual forum, please feel free to ask. And I do have a first question to kick off from Janet. Would you like to go ahead, Janet?
Sure. Maybe I can take myself off video too. I don't know. There. So my question is to Bernard and maybe to Wendy as well, familiar with the process of moving forward with the Alliance and some of these documents and consensus statements. I'm interested when you're talking about the working group on health promotion and well-being, how proactive are you going to be in bringing in the voices of Indigenous First Nations people in some of the countries, and especially I'm talking about Canada, but there are other countries as well, sometimes hard to reach, sometimes remote, and yet, as we talked about earlier today, ones with traditional knowledge and ability to exchange and tremendous resiliency, etc. So how's that process going to work in terms of making sure they're there from day one in terms of, let's say, the working group process? Thanks.
So if I can take it first before Wendy. Thinking about the conference this year, and having listened to, well, Jen Goodall and also the Minister for Health and the representative or speaker on behalf of the First Nations, of course, including the ceremony, it really reminded me, re-energized me, and also, in fact, made me remember that there is a lot of ground that we still don't cover, even in health promotion, even as we should be progressive civil society. So we will be very proactive. We'll be very proactive because when you talk about inclusion, you talk about marginalization, you talk about inequity. These are really the factors that we don't really think about, but they are critical in my own country, in many other countries. Even when the presentation on digital equity was made earlier today, I was thinking really, because I know communities that have a very different way of living and working. So yes, it will be right on top there as a priority. Now you've given me the chance also to say, we are not mentioning youth enough, but in this conference, it was very clear that youth should play a far bigger and a different role. And I think even Indigenous or First Nations should also have the same thing, where they really are not brought in so that it can be a rounded forum or a rounded document, but they are brought in because they can lead. They can lead. There's knowledge, there are approaches that we shouldn't bring on board as additions rather than as central to it. So yes, right in there, inclusivity and First Nations, Indigenous people will be right there, and youth. I think there was mention about Greta and other youth. Really, there are so many things we do, and young people look at us and wonder if we really are thinking about 20 or 30 years from now, which is what they're doing. So welcome. This will be not left behind.
Thank you, Bernard. And as we close the panel, I will just say, indeed, as we've heard from multiple panelists and plenary speakers, the invitation, indeed, the expectations have changed. The goalposts have changed around what is expected for consultation, what is expected for diversity, equity, inclusion, all ages, and diverse subpopulations. And it's not just about including Indigenous on a list of equity-seeking groups, but rather working from the strengths of these populations that have indeed demonstrated their resilience despite colonialization, et cetera, and looking at those principles of collaboration, not just late in the process, but as a formative and essentially early part of the process. So with that, I will thank all of the members of our panel. And as we close, I want to wish you all a wonderful day. Please do visit the forum area of the app to register any comments or key messages that you'd like us to include in the consensus statement going forward. And if you'd like to pay attention to the Alliance for Health Promotion's website and the CSIH website for future details, we would welcome you as part of the drafting process. Thank you and best wishes for a wonderful day.
Thank you and bye everybody. Thank you, Wendy, for all this and the whole group, the whole team. Fantastic job. Keep healthy and well.
Keep healthy, everyone.
Thank you, Wendy.
Bye.
Thank you, Bernard.
Bye.